Hello, I am Dr. Amit Sharma. I am a spine surgeon working at Pinnacle Ortho Center in Thane. Spinal stenosis is a condition which affects spinal cord and spinal nerve. It can affect the spine in any part, be it cervical spine, thoracic spine, or lumbar spine. Based on which part of the spine is affected, patient might present with different kind of symptoms. A disc prolapse, overgrown ligaments in the spine, or overgrown joints of the spine can lead to compression of the spinal cord and spinal nerve. The primary symptoms of the patient will be based on which part of the spine is affected. If the lumbar spine or the lower back is affected, most of the patient will have pain, tingling or numbness traveling down the leg. After some time, in severe cases, the patient will have difficulty in walking. They have to stop after walking few distance, and this distance can gradually decrease. In the beginning, if you are able to walk half a kilometer, then with time this might get reduced to 100 meters to 50 meters also. In very severe cases, patients are so incapacitated that they are having difficulty even to walk to their bathrooms. If the cervical spine is affected, then the patient will have tingling, numbness, may be associated with weakness in the arms as well. Many of these patients will have difficulty in walking because their legs will have spasticity or tightness. These patients will walk with significant imbalance. Their hand functions also will be affected, and in some patients they have difficulty in feeding themselves with their hand, holding the spoon, even buttoning their shirt. If the spinal stenosis affects the thoracic spine, which is the upper back, then the upper limbs are spared, but the lower limbs will be affected. In these kind of situations, patient will have difficulty in walking because of tightness in the legs and loss of balance. In very severe cases, be it cervical, thoracic or lumbar spine, patient's ability to pass urine or control the stool also can get affected, and this is a very severe and extreme condition. Treatment for spinal stenosis will be based on the severity of the symptom and the magnitude of spinal stenosis as seen on the MRI. Majority of the patient in the beginning at least are benefited by medicines and physiotherapy. Some amount of activity restrictions like avoiding sitting on the floor, lifting heavy weight or bending forward need to be taken care of. A belt is given to provide support in the cervical or lumbar spine. If the patient's symptoms are not getting benefited by these non-operative means, then a spinal injection or epidural injection can be tried. This injection has small amount of steroids, so once they go inside the spinal canal, they will reduce the inflammation around the spinal cord and spinal nerve and gives the patient significant symptomatic relief. Now, these injections are not going to cure the underlying pathology. They are not going to open up the spinal canal, but they are a good measure to give the patient symptomatic relief, especially for the patients who don't fit into the surgical category because on the MRI the pathology is not very severe, or the patient who wants to postpone or avoid the surgery for the time being. In very severe cases where patient is not responding to a physiotherapy or medical treatment, and if they have tried the injection therapy also and that also didn't last for a long time, a surgical intervention might be required. In majority of the patient, the spinal stenosis is an irreversible condition. Their symptoms might go up and down, their symptoms might wax and wane. However, their spinal stenosis will remain same, it will only increase with time. So once the patient reaches a severe stage where their daily life is significantly affected in terms of difficulty in walking or they are not able to carry on day-to-day activities, their hand functions are significantly affected, they are not able to sign the check, they are not able to feed themselves. In these situations, a surgical intervention is recommended. The aim of the surgery is to free up the spinal canal so that the spinal cord and spinal nerve can recover. Based on the pre-existing damage to the spinal cord, the recovery will be determined. Majority of the patient recover to the extent that they are able to carry on their day-to-day activities without any assistance after the surgery. However, if part of the spinal cord is damaged significantly before surgery, then that part may or may not recover, and this will be based on the severity and the duration of the symptom patient had. Majority of the patient require only a decompression type of surgery wherein the spinal canal is open and there is no instrumentation required. However, in certain situations where there is too much movements happening between individual vertebral segments, or there is pre-existing listhesis wherein the one part of the bone is moved forward over the lower bone, and instrumentation surgery also will be required. If the patient was able to move before surgery, then they are allowed to sit and walk right after the day of surgery. However, if the patient was significantly disabled before the surgery, then it might take some time for them to get back to their normal life of sitting, standing and walking, and this will be decided by the nerve recovery. So if you have any symptoms related to spinal stenosis like tingling, numbness or weakness in the arms or legs, and if you feel that you might be suffering from spinal stenosis, then you are welcome to show me at Pinnacle Ortho Center. I sit here on Monday, Wednesday and Friday in the morning, and the contact details will be provided on the screen.